Okay, we're back, and Kylene had a follow-up question for the renal hypertension.
Okay, so this patient doesn't have blood pressure, high blood pressure all the time. It's only by instant. So does she take the formula we discussed when she has the high blood pressure, or does she take this throughout the entire week?
Okay, it's her brachial pulse was so strong, you know, it could drive a Mercedes. So it's very difficult for me to believe that she does not have high blood pressure at home. Maybe her cuff says she has low blood pressure or normal pressure. I don't quite believe it, quite frankly. So I would give her these type of herbs for her kidney for some time. This is a woman who has no high blood pressure medication at all. And it turns out that Western drugs in this case could work very well. A diuretic in this case will not work well, like hydrochlorothiazide. But what the patient needs really is an angiotensin II blocker like Benicar, or another name for that is losartan, or an ACE inhibitor, lisinopril. These two classes of drugs will soften the vessel wall so that when the blood pulse moves through the vessel wall, the capillary can open up. It's more limber. This will take the pressure off the small arteries of the kidney. Those would be appropriate class of drugs to give that patient. But she doesn't want to take drugs, so it's, she's stuck with us. So we have to do the same thing. We have to soften the vessel walls and protect her kidney. And I actually taught her how to feel her brachial pulse. And I asked her when she goes home and she measures her blood pressure, and if the blood pressure comes out normal, which she claims it is at home, like 130/70, I want her to feel that brachial pulse. And if it's still pounding as it was today, then I know this woman has a problem no matter what the blood pressure cuff says. And that problem, the danger of that problem is, of course, in the kidney. If those capillaries in the kidney get harmed in any way, then she could have renal damage. So, quite frankly, she needs a drug. She needs some kind of drug, lisinopril. So if I can't get that brachial pulse to calm down over the next 3 weeks, I will insist that she takes pharmaceutical drugs. Okay? Okay, what's next?
Okay, so we have 40-year-old patient, very sensitive with needles. She's had chronic fatigue, insomnia, low back pain, migraine headache, neck shoulder tension. She's a patient who's had a very stressful life in terms of her workload. Over the last 10 years, she's a workhorse. She's very smart, very bright, and she's been diagnosed with ADD. So she takes drugs like the Vyvanse and Adderall to focus her mind, but she wants to come off of these drugs.
And her complaint, of course, is fatigue. What's interesting with these kind of ADD patients is they're almost always deficient in tyrosine, which is it's an amino acid. And that's the T and T3 and T4. These people almost always have some sort of thyroid problem. And of course ADD is, where they have attention deficit disorder, where they can't pay attention to something. And they're given a drug, Adderall, which is basically speed, and which does have an effect on the tyrosine in their body. It doesn't create tyrosine, but it sort of circulates it better. It's better just to give them the amino acid, and very often they snap out of it. Now, from a Chinese medical point of view, it depends on the pulse, of course. And so let's just look and see what we've been giving her. She had some back issues, and we could see that she had a little kidney stone on her right ureter, I believe. And so we gave her some herbs for a kidney stone to get rid of it, and because she has some back issues. But her main issue is this chronic fatigue, and her pulses are very deep. How much does she weigh? Is she overweight?
She's not overweight. She's tall,
Okay.
and she's about average weight. She looks very lanky though.
Yeah.
Yeah.
And that was her major thing, the chronic fatigue or the anxiety?
The chronic fatigue and the anxiety is a portion of it.
Okay. And what was your diagnosis when you saw the patient? In other words, what's the matter with her from a Chinese point of view in your mind?
She had this is a kidney heart disharmony. She had, from the very beginning, let's take a look. She had the reverse hook pulse, but she was deficient. She was deficient in her left side. The heart was weak,
Okay.
and the adrenals were too hyperactive. The kidney was too active.
And her fatigue is 50% better, her anxiety is 80% better, insomnia is 50% better. So she's responding to treatment. We just deviated from it just for 1 week because of the kidney stone. And if I remember right, she eats a lot of spinach. So people who eat a lot of spinach will be susceptible to kidney stones. You need to know that.
So my question, she's taking she works well with the reverse hook pulse, the formula that we gave her. However, she's still taking the Vyvanse and the Adderall as needed for her
Okay.
job. She's under a lot of pressure
What we're
in her
going to
job.
do, what we'll do with this patient is we'll continue with the Zerbai Digwangwang. She has warm hands. We'll continue with the Zerbai Digwangwang 20 grams, Sheng Mai Song 40 grams, and Tianwang Bushendang 40 grams. That will take care of the reverse hook pulse. Then we will give her tyrosine. We will give it to her. We'll start her with 1 pill in the morning and 1 pill in the afternoon. And we'll see if that doesn't make it so that she doesn't have to take Adderall.
Okay.
That will be our protocol for this patient. It's amazing what you can do with amino acids. They don't work as well as Chinese herbal medicine done properly, which is far more holistic. But sometimes there is a brain chemistry problem, mostly because a lot of people do not eat enough protein. They don't eat enough meat. And so a lot of Americans, and I suspect Europeans, are basically protein deficient. And that leads to all kinds of trouble. Serotonin deficiencies, because serotonin is tryptophan, which is another amino acid, is a key ingredient for making serotonin in the body. And by simply giving tryptophan, the serotonin will increase in the body. The person will feel calmer, less anxious, less irritable. Anyway, that's what we're going to do with this patient, and we'll see how it works, and then we'll pick it up on the next week and see how she's doing. Okay?
Thank you.
All right. Good. That's it for that case.